San Francisco has become the first American city to ban sales of e-cigarettes until their health effects are clearer. Yesterday, officials voted to stop selling the vaporizers and made it illegal for online retailers to deliver to addresses in the city. San Francisco's Mayor London Breed has 10 days to sign off the legislation, and the law will come into force 7 months from that date. We can speak now to Martin Dockrell, the tobacco control lead at Public Health England. Thank you very much for joining us. What's your reaction to that move in San Francisco?
Well, it strikes us as odd that it's legal to, it'll remain legal to buy cigarettes, to buy alcohol or to buy cannabis, but illegal to buy e-cigarettes, even though the US National Academy of Sciences have found them to be likely to be far less harmful than smoking. So I guess it's not the approach we're likely to take in this country. Here we think the regulation should be proportionate to the risk.
What would you say the risk is?
The actual evidence of harm is extremely small for e-cigarettes. PHE have said e-cigarettes are likely to be at least 95% less harmful than smoked tobacco. But, you know, smoked tobacco is extremely harmful. E-cigarettes aren't risk-free, but far less harmful than smoking.
And that's where the concern comes in San Francisco. They do cause harm, and it's very hard to quantify it at the moment because of the potential, the concerns around the long-term effects that can't be measured at the moment.
Well, perhaps, but it's not at all difficult to ascertain the harm from tobacco, alcohol or cannabis. I mean, smoking tobacco kills half of all lifelong users. It's the most hazardous consumer product available in the UK or the US.
Yeah, but when cigarettes came in, it wasn't clear, was it? And it took a long time to build.
Yeah, we have very good science now, which allows us to ascertain the harms from tobacco. And similarly, we can analyze all the chemicals in e-cigarettes. The exposure to chemicals is just way, way lower, and harmful chemicals particularly. So we have lots of studies that analyze the vapor and compare them to smoke, and consistently we find the level of what we call toxicants, of poisons if you like, are way, way smaller in e-cigarettes compared to tobacco smoke. There's really no doubt about it. E-cigarettes are far less harmful than smoking.
I mean, just on the concerns around the harms, and obviously I hear completely what you're saying about a comparison to cigarettes and how, you know, just it's another world in terms of the level of harm. But there are concerns around the impact on the body's cardiovascular system. There are concerns that particles from vaping damage the lungs.
Sure. If you're not a smoker, then there's no reason to start vaping. If you are a smoker, then certainly in terms of your lung health, your heart health, your risk of cancer, the risks from e-cigarettes are far, far smaller. We would encourage any cigarette smoker to try vaping, and for any vapers to completely stop smoking, because it's smoking that's harmful. The big harms come from smoking. You're much better switching to vaping.
Mm-hmm. So you said that if you're not a smoker, there is no reason to start vaping.
Yeah.
In the United States, the concerns also centre around the fact that people are starting vaping who have never smoked before. Kids are starting it.
Well, in fact, the data, certainly from the UK, shows that almost all regular vapers, and this is both adult and youth, are current or previous smokers. So the regular e-cigarette users among young people in the UK are almost all smokers or ex-smokers. Less than half of 1% of young people who have never tried smoking are regular vapers. So those numbers are really, really small. Now, definitely, we would not encourage young people to start vaping. Vaping is not risk-free, but if you're a smoker, it's a very good idea to switch from vaping to smoking, and we shouldn't allow anything to obscure that message.
Thank you very much for joining us.
My pleasure.